Hello and welcome to this new episode of Open Book Entrepreneur. Today we have Shayna here with us all the way from New York, and that's fantastic because this podcast is totally international and she is the world wellness expert. She actually healed her autoimmune disease, and then on top of that, obviously she's helping others now. So, Shayna, please introduce yourself and your shiny business to our audience.
Thank you, Tony, so much for having me here. I really appreciate it, especially New York all the way to Germany. That's pretty cool. So, long story short, I've been a registered nurse now 33 plus years, a board certified nurse practitioner here in the US. So that's basically I do everything the doctor does. Um, where do I begin? Then, over the years, well, I got into it because my grandma raised me with powers of the plants. But then my grandpa was a pharmacist and he died of a lethal prescription drug interaction. So I think that's why grandma went the naturopathic route. And I grew up with that, 5 college degrees later, 4 nursing and medical license, 30 plus years as a licensed healthcare pro. Here I am. And when I went into all my autoimmune symptoms and suffering, exhaustion, pain out of proportion, I felt like the doctors then were just gaslighting you. We don't know, it must be in your head. And that's common with autoimmune, especially in the US, that the doctors don't order the right test. So the patient doesn't get a diagnosis and the doctor says, you're normal. And I'm like, I don't feel like I did a couple of years ago. Something's wrong. And this is very common in the US. So long story short, I healed myself holistically. I had all these autoimmune symptoms, issues from pain, exhaustion to MS and heart failure. And what I was told by the heart doctor, I said, listen, we have to get to the cause because otherwise my heart's going to still get worse. And his reply was 98% of the patients in heart failure, I never figure out their cause. So what did I do? I fired him and I did my own research. So just want to say, ladies and men out there, you have to advocate for your health and wellness. If you're not happy with your practitioner, get another one. Advocate for yourself, do your own research. But I went into nursing because I loved helping people. But I found the traditional sick care system here in the US was just keeping them sick for recurring prescription writing and to keep the clients. So that's when, how I left is I found that as the nurse, I knew what the patients needed and the prescriptions they needed or not. And I couldn't do that unless I went back to school to become the NP. So I went back to become the NP because the doctors weren't listening to the nurses and what their patients needed. So I said, you know what? I'm going to become an NP so I can write the tests and write the prescriptions that I need. So long story short, that's it in a
So,
nutshell. And yeah.
Just a quick question for our international viewers. What is MP?
Oh, NP is nurse practitioner. So here in the US, we have LPN, licensed nurse, registered nurse. Then higher up is a physician's assistant, PA, and then is nurse practitioner. So basically, I don't know if there's anything I possibly can't do that the doctors do here in the US. When you come in, I take your history, I do your examination, I order your laboratory and diagnostic tests, I give you your diagnoses, and I can write your prescriptions.
Pretty much, yeah, everything that doctor does. And now, like, so what, how, because you mentioned a number of things here, so I'm just like, trying to actually go through all the points that you mentioned. And one of the big things, obviously, I have a very close friend who's recently been diagnosed by, for MS. And how did you manage to heal yourself from that?
That's a great question. So, I have not had flare-ups or symptoms in years, and I take no medications. And I found that after being in the healthcare industry for over 30 years experience, all the patients with autoimmune, because MS is considered an autoimmune condition, all of the patients with autoimmune, no matter which of the 100 autoimmune disorders they had, whichever doctor they went to, and whichever med they were on, the job of the meds was to suppress their immune system because they thought it was fighting itself. But that's the worst thing to do because now with the suppressed immune system, all of those patients were sick more often with contagious infectious diseases. Their symptoms were more severe. They were lasting longer. I was seeing them in the ER all the time. They were afraid to leave their bubble. Then they would need more meds for the side effects of the other meds. So with my autoimmune, like, no, you ain't doing that to me. And I knew to get a different outcome, I had to do different than the patients were getting. So I combined several modalities together, and I know this is a short show. So basically, old school naturopathy with cutting edge science, working on a cellular and genetic level to attack the true underlying root causes. I don't see it. What happens is here in the US, the doctors, you have a diagnosis, they give you a treatment. I look at the patient as a whole. What are your signs, your symptoms, your abnormal tests, your normal tests? What have you tried? And I put all the pieces together and give you what's best for you. So it's not often a medicine because I find medicine just treats a symptom and never gets to the cause. And I gave this example a couple days ago, a roof leak, right? You put a little bucket under, and then you need a bigger bucket, more buckets, and a mop, and electrical and mold. That's what medicine does for us, is like putting a bucket under a roofy leak. It's taking care of it for now, but the problem is still there, getting bigger, bigger, bigger. What if we just fix the roof leak and we had the right tools? So that's what I want to do for my patients, is give them the tools that they never had so they can fix the problem and don't need all of these quick fixes.
Totally. And we were talking about like what this entails.
Ooh. Okay, well, each person is individual. So I can't say, hey, you have MS, you get this. That's what the doctors traditionally do here. I don't. I do this individually. So I have online and in-person classes, courses, workshops, and private consultations. Most of my autoimmune warriors go through my 90-day program I call Your Wellness Journey, because there's so much information and it takes out all the overwhelm. See, here in the US, the doctors say, try this, try that. No, I know what works because I had autoimmune and I've been treating it for over 30 years with patients. So I don't give them guesswork. I give them a full 90-day comprehensive program where I meet one-on-one with the client individually. You know, I get their records ahead, they fill out forms like the doctor. I have a 60-minute consult with the person. Then I have about 40 lessons pre-recorded, professionally done. They get the dashboard access with the manuals in there, digital and printable, the workbooks that go slide for slide with my videos. 300 PowerPoints I created from hundreds of images, almost 40 pre-done videos. Then throughout the 90 days, I get on live lessons every other week with the group and live Q&A. So they get answers every other week. And when they don't have a live Q&A, they have a chat where they can drop their questions and get answers within 24 hours. And then they have a second private confidential consult if they don't want to ask me something in the group. So it merges individual learning with group learning and private consults, because I feel they need a full comprehensive program. It goes into what foods are they eating that are triggering, what foods are better for them that have medicinal purposes, mindset, it is possible, I did it, other people did it, how to attack the true root causes, how to work on a cellular and genetic level. So it's all inclusive. But it
Also,
takes out the overwhelm because it gives them little calls to action every week, I'd
definitely.
say.
And if someone wants to actually get in touch with you, connect to you, or find out a little bit more about what you do, how they can do that?
Sure. The best way, well, on all the social medias, they can find me under Shayna Melissa Stockman, or the website worldwellnessexpert.com. That's worldwellnessexpert.com. I'm on YouTube, Instagram, Facebook, Twitter, LinkedIn. The YouTube channel is Shayna Melissa. Just type in the search Shayna Melissa, I'll pop up.
Fantastic. I can definitely we can include the links in the description of this episode. And then if there is any question, maybe I didn't ask you in this short episode, even though like your story and what you're doing is super interesting, maybe we'll sort of have to record a longer version. But if there's anything I didn't ask you or something you would like to share maybe with the audience.
Okay, well, there's always more, but I'll try to make it short and sweet. You were asking me right before we taped about an obstacle with business. And I find it's like this. If you have a pizza place, Tony's Pizza down the block is not going to tell you how to make the best sauce. So the problem is you can get mentoring in other fields, but when you're your own business owner, a lot of people might look at you as competition and might not want to share their secrets. But what I learned is We live in a world of abundance. There is plenty for all of us. There's plenty of sick people. I can share them with all other healthcare professionals. And I think we have to stick with the people that are team players because they do say, what is that? Rising tides raises all ships. So I want to work with the people that have that mentality, not the scarcity, but the abundance. And maybe someone, hang out with people that know more than you and can teach you how to get there. Like, that's what I want to do for my autoimmune warriors. And the other tip I can give is number one tip for me. Well, two things. That bottle of water. I don't know if you heard that story, right?
No.
Okay. So this is a good one. The bottle of water, right? You could pay $1 for it at the dollar store, $3 on the plane, and I don't know, $7 at the fancy restaurant. So you have to go where you are valued because I will have people maybe with my lowest ticket try to haggle like on the flea market. And then I'll have people with my highest ticket that is thousands of dollars and they'll jump on it being like, oh my God, this is such great value. So we have to go where we're valued. And if I'm not valued, I won't go there. I will decline seeing a client if I feel they're not respectful. It's a two-way street. They get to choose us, but we also get to choose who we collaborate with and who we want for clients. And I don't want every client. I don't. And I don't want to collaborate with every podcaster. So I think choose wisely because our time is valuable. Go where you are valued, where they will pay $10 for you as that water bottle instead of that $1 because you're trying to sell water at the water fountain. Maybe go to the desert or something like that. And the other tip is a lot of times we put our business ahead of our health and our life. Guys, we have to stop doing that, please. There's 1,440 minutes in the day. I wish people would just take 4 minutes out of the day and do a happy dance, right? 1,440, you're worthy, you're deserving of just 4 minutes to relax, burn a couple calories, build your confidence, your stamina. I was in heart failure and I was putting my job at the time ahead. And I'm like, oh my God, I am worthy. I am deserving. Why am I treating the world better than myself? And a lot of us do that as entrepreneurs. Especially if we're in the sandwich, we're in between treating the kids, the spouse, the parents, and we're putting ourselves last. But, on that plane, when they say when the plane's going down, you got to put your oxygen mask first. It's not selfish, it's selfless because if you don't put on that mask first and save yourself, you're dead. You can't help the kids, the spouse, the parents, and your business. So guys, prioritize yourself a little higher. You are worthy, you are deserving. Go where your bottle of water is worth $12, $20. I don't know. I have so many good tips.
Totally. Yeah. I mean, speaking of this super expensive bottles of water, one of the most expensive bottles of water I ever paid for was in Universal Studio. And I don't remember now what was the price, like $15 or something like that. Universal Studios in LA. But I can tell you, it was such a hot day, and I really needed that
So you
water.
really valued that water and paid the 22, where if you were at the water fountain, you might not have paid the $1. So
Exactly.
I think we have to go where we're valued. And I just wanted to leave them with this. A lot of times there's so much bad news in the world, especially nowadays, and I don't want to get political, but I created a daily dose of positivity.
Mm.
Where if they want, it's a free gift. They get a daily dose of positivity. It's 30 screensavers, different one for every day with a positive message, maybe a little call to action to move their needle forward. And they can get that at worldwellnessexpert.com/30 days. Worldwellnessexpert.com/30 days. They can use the screensavers for their laptop, their phone, change it out every day, every month, whenever they want to.
Wonderful. Yeah, definitely we can include this link in the description as well. And yeah, if you have any questions for Shine or me, ask them in the comments. We'll be more than happy to answer them. And on top of that, if you like this episode, drop us a like, subscribe, and thanks for watching. See you all in the next episode. Thank you, Shayna, for being a guest. That was fantastic. All the best and see you soon.